Hello, welcome to Sketch Notes on a Pandemic. My name is Lucy Johnston, Health and Social Affairs Editor of the Sunday Express. My guest today is Dr. Aseem Malhotra, a professor of evidence-based medicine whose controversial but influential views on diet have led to changes in government sugar guidance. Dr. Malhotra has recently spoken out about why he thinks Britain's colossal COVID death toll is nothing to do with lockdowns, but down to bad food and bad pharma. If you're interested in these conversations, please like and subscribe. We have plenty more coming up. Welcome, Aseem. Many of our listeners will be aware of your work, but won't know much about your background. What led you to devoting so much of your life to public health?
Yeah, I think first and foremost, what inspired and drove me to become a campaigner in this space to improve people's health was actually to protect and save the NHS. So, having qualified in medicine in 2001, I'd seen over a number of years, getting towards 2010, over several years, increasing pressure on the system. Practicing as a doctor, there was more and more people coming in with chronic disease, and ultimately that was rooted in related to poor diet and people having excess body fat. And I'd seen that situation worsen, and certainly had become more and more aware of the science behind the likely drivers of that. And you've alluded to the issue about poor diet before, but just to give it perspective for the listeners, poor diet now contributes to more disease and death than physical inactivity, smoking, and alcohol combined. So it is the major issue when it comes to our health. And once I had that realization, combined with the understanding of the limitations of modern medicine, I think one thing that's great about medicine is we're very good at treating acute problems, acute illnesses, heart attacks, strokes, people with broken bones, people with infections needing support and oxygen for pneumonia, for example. We're very, very good at that. But what we're not good at is actually 80 to 90% of what's causing most of the healthcare crisis at the moment is dealing with the chronic disease burden. And almost all of that is rooted in lifestyle and environment. So, and unfortunately, the pills that we use for many of these diseases, whether it's type 2 diabetes, high blood pressure, heart disease, have only very marginal small effects. In fact, most people taking these pills don't get any benefit at all.
I'd like to just step in. Sorry, I was going to step in there because I know, and you're probably very aware, you have been criticised. What led you to believe that the emphasis should be more on prevention as opposed to some of the treatments that are given, statins, for example? Why did you almost divert off? And what do you say about those criticisms? Yeah.
Yeah, so I think it was, for me, it was just, first and foremost, my duty and responsibility, Lucy, is to my patients and scientific integrity. So when, I'm an independent doctor and researcher, and I do my analysis with no financial conflicts of interest. And the majority of my work that I do, I don't get paid for. This is purely out of regard for public health, to protect not just the health service, but improve the population's health, so that we can live in a society that is actually generally happier and healthier. And as COVID has also highlighted, we're all intertwined. So from my perspective, and I don't think we are maximizing our own individual potential for being happy if our community is not happy or healthy. So for me, that was a no-brainer, and certainly I was at the front line, seeing that, witnessing it very viscerally as a healthcare clinician. That became very obvious to me. So when I advocate for these things, I'm just trying to put things in perspective so that more people are educated and aware of what is a contribution of modern medicine to life expectancy and health, and how much is related to lifestyle and prevention. It's very simple from that perspective. But actually, most people are unaware of this. They have an exaggerated opinion, opportunistic view of modern medicine. And at the same time, they underappreciate the lifestyle changes that can rapidly improve people's health. And some of that is rooted in and just lack of knowledge. But a lot of it, unfortunately, is rooted in misinformation that comes from the very industries that are upstream drivers of all these disease processes. And the two big industries that I focus on, who, in my view, are the biggest culprits behind this sort of global pandemic of chronic disease, are the food industry and the pharmaceutical industry.
So let's step into that.
It's just very basic. This is the way business is done. People need to understand and acknowledge that these industries primarily focus, their fiduciary obligation is to make profit for shareholders, not to give you the correct information, and not necessarily to give you the best treatment. And once you acknowledge and understand that, then it becomes much easier to be able to find solutions to improve and resolve that system problem.
So let's talk about the food industry. What is going wrong with that? Where are we failing, and why is it driving ill health?
I think that the low-hanging fruit, first and foremost, is that we've got an oversupply of cheap, sugary, ultra-processed food that has become almost unavoidable.
How do you define ultra-processed?
Yeah, so it's more than 50% of the calories that are consumed in the British diet. And ultra-processed, in very simple terms, Lucy, is essentially any packaged food that has at least five or more ingredients, usually with additives and preservatives, and is often a combination of starch, sugar, and unhealthy oils or unhealthy fats, are deliberately designed to maximize palatability, shelf life. But what the science is telling us now, and there's more than 30 good quality observational studies that show that these foods are associated with increasing the risk of many diseases, not just obesity, but type 2 diabetes, heart disease, cancer. I think the evidence is now...
Yeah, I mean, is it well established? I mean, the government has got its Eat Well plate, hasn't it? And they still recommend a certain amount of carbohydrates. There's still an idea that fat is one of the drivers of cholesterol and heart disease. Do you think that it's accepted now that this is not necessarily the case, and that these ultra-processed, highly refined foods are the drivers, or is the jury still out? Where is the science on that?
So I think it's amongst people who are independent and aware of the science behind all of this, it's increasingly accepted that this is the major issue, major problem. And, in very simple terms, Lucy, if you just look at obesity alone, we can talk about heart disease separately in a second. If you go back 3 or 4 decades, there was virtually no obesity in certainly in the UK or the USA. And it was only when changes in dietary guidelines were introduced in the late 70s and early 80s that in those two countries, is that when we then started to see a rapid increase in the prevalence of obesity.
And what were those particular changes? Sorry, those changes, what were the key things that you think influenced
the key thing was that we need to curb our consumption of dietary fat, and in particular saturated fat, so less than 30% of calories and less than 10% of saturated fat. And prior to that, interestingly, a lot of people talk about this in the previous generations, people were advised to limit their starchy and sugary foods because we knew that caused weight gain. But what happened with the change in dietary guidelines was, because of this reductionist concern and view that saturated fat, based upon very weak evidence at the time, was a driver, a primary driver or a driver of heart disease, it completely changed dietary guidelines. And it isn't just the dietary guidelines that changed, it was how that was then taken up by the food industry, in the sense that it would then start marketing a lot of products that were, low fat and perceived by people to be healthy, but were actually loaded full of sugar. And the reality is that has clearly been quite detrimental. And people, people's food choices are often influenced by the environment they're in. I mean, even our hospitals, Lucy, just to show how dire the situation's become, is our hospitals are now a branding opportunity for the junk food industry. So 75% of food purchased in hospitals is considered unhealthy now. And, and I started, one of the things I started in one of my earlier campaigning issues was actually to try and, to ensure that we get a hospital food environment healthier, because we need to start in our own backyard. And 50% of NHS employees are overweight or obese. And some of that as well is because of lack of knowledge amongst the medical profession and nursing profession, and even lack of up-to-date evidence amongst dietetics profession as well about the impact of food on health. So because it's not part of training, there's lack of knowledge, there's lack of confidence to actually implement this even on an individual level when doctors are having consultations with patients. But I think, and this is not fat shaming, I mean, just look at many of these healthcare professionals who are obese or overweight. It probably should be enough for you to at least think, hold on a minute, do they actually have a full understanding themselves about the impact of health, number one? But number two, I think the bigger issue is how the food environment itself determines our food choices. So because these foods have become unavoidable, often again marketed as healthy or whatever else, combined with the prolific advertising by, the junk food industry, just to give you some perspective of the imbalance, Lucy, 2017, the food industry spent about £143 million on marketing confectionery, crisps.
You're talking about the UK, or are you talking about
in the UK? In the UK, and sugary drinks, and that was 27 times more than the government had spent on healthy eating campaigns. We can argue the toss about whether those healthy eating campaigns were the right advice, but just to give you some perspective. So go to the real issue is ultra-processed food.
If you were in government now, what would you do to change things? Would you change the Eat Well guide, and would you perhaps put more tax on sugar? How would you disincentivize people from eating the wrong foods?
Yeah, I've written articles and papers on this, Lucy. So I think what we need to do is just take a step back for a second and think about how did we manage to curb tobacco consumption in this country. And these policies have been adopted by many Western European countries now. Remembering that in the 60s and 70s, more than half of all UK, just think about that for a second, half of UK adults were smokers.
You could argue it's slightly different because they're affecting other people, and you're smoking in a room and people get secondhand smoke, to be punitive to people that are eating the wrong foods. Is that the right course, if that's what you're suggesting? But anyway, I'll let you.
It wasn't just about secondhand smoke, Lucy. So the reason for this problem was that we knew that smoking was linked to heart disease and driving death rates in the population. So what did we do? To the smoking ban indirectly, yes, would have helped passive smokers, but I mean, we need to just address this properly and accurately. So what the regulations did was to target the availability, the affordability, the acceptability of cigarettes. So availability by reducing public smoking bans was one of them, but the effective availability by reducing the exposure of people to cigarettes in terms of buying them. You can still buy cigarettes, of course, but it's not as easy as it used to be. It was like a default, but you can just get them anywhere. And the affordability, taxes on cigarettes raising the price, and the acceptability for public health education campaigns. We need to apply the same principles to ultra-processed food, and that will almost certainly have a big impact on improving population health.
But for people who are on I was going to say, for people on very low incomes, and you will know this as a campaigner, it's very difficult to afford the more healthy foods. So would you also address that at the same time?
Yeah, it's harder to, absolutely right. And those are the people that actually are worst affected by these sorts of food choices. So what would need to be done is also subsidize whole foods like fruit and vegetables at the same time, so that we are then not unfairly penalizing people from poor backgrounds. So they have got an alternative that is healthier, that they can afford.
Great. So in that sense, it moves us on to coronavirus and the current pandemic. And I know you've written and talked about how the obesity epidemic in this country has been one of the drivers of our high death rates. And I wanted to just touch on that with you, if you would like to talk about it. I mean, you were quite early on very aware that this might be the case in this country, having looked at the data from Italy. But yeah, let's have a chat.
Yeah, sure. So I think we now, that was something that became apparent. I remember writing, in fact, the first piece, interestingly, I wrote on this, the first article was in the Sunday Express. And then I followed with a piece in the European Scientist, which became, went viral, and then the Telegraph, and and I wrote in the Physician as well, in a medical journal about it. So essentially, what is now clear is that 90% of the death rates of COVID-19 around the world, Lucy, have occurred in countries where more than half of the population are overweight or obese. So we know that 2/3 of people in this country are now in that category, certainly similar in the United States. And on a very basic biological level, what happens is excess body fat itself is see it as a toxin to the body.
So right from the get-go, once the pandemic kind of emerged, I remember you were trying to highlight the importance of exercise and getting out there. And do you think that's the way you would have gone? I mean, lockdown, do you think that has been an effective strategy?
It's a really good question. It's very debatable, Lucy, because there's a lot of mixed data out there that once you account for social distancing and hygiene measures, the question and debate is whether lockdown in addition provided any extra benefit, and that is still disputed. What isn't disputed is the fact that, living a healthy lifestyle almost certainly give you a better chance at survival from COVID-19. And I think the public health message isn't strong enough on that. Exercise itself certainly is very important for physical and mental health, has zero impact. Let me repeat, zero impact on weight loss. I busted that myth several years ago in British Journal of Sports Medicine piece with two international scientists. It's all about what you eat. That should have been the main focus. So the public health message should have been from the Prime Minister, eat real food, protect the NHS, save lives, as well as so-called stay at home, which again is now being disputed.
So even the stay-at-home message could have been counterintuitive, really, in the sense that we actually want people outside, getting sunlight if there is any, vitamin D, and moving. This helps with...
But eating real food, ditching the junk. See, remember, this is 50% of what people are eating. So that's not a small amount. It's a lot of food that is just absolute junk, toxic to the body, doesn't provide much nutrition, and increases your risk of weight gain.
So talk us through what you consider to be a good diet. And I know you've had critics of the POPI diet, which you can define for us. But what should people be eating and what should they be avoiding?
Yeah. So just to be very clear, Lucy, on this, the critics are basically the guys. It's very straightforward. The critics are the people who profit from destroying people's lives and killing them. This is what these industries ultimately are doing, especially the food industry and to some extent the pharmaceutical industry. I can argue the toss with anybody on that topic, anywhere, any place, anytime. I'd be happy to do that and explain what they are doing.
So are the critics the food industry?
Deliberately misinform people for the purpose of profit. This is what these industries do. And indirectly, really, what they are is they are interfering with true informed consent. And therefore, I'm a Democrat. These people are enemies of democracy. Absolutely. These corporations are enemies of democracy. So, of course, if I'm speaking the truth, I will get criticized from those enemies of democracy. And that's what happened.
You've made a few enemies. Is that inevitable, given your stance? And will you carry on?
So first and foremost, Lucy, I'd like to hope and think that I've made many more friends than enemies. But actually the enemies are just people who are just trying to protect their profits, really. So what I would say is that, I quote Simon Chapman, who's a professor in Australia, considered probably the single most influential man in Australia that brought about, influence tobacco control in Australia. And he says, as soon as your work threatens an industry or an ideological cabal, you will be attacked, sometimes unrelentingly and viciously. So grow a rhinoceros hide. So that's the first thing in response to that. For me, it's purely, I'm inspired by my patients. They sustain me. This is my duty and responsibility to scientific integrity and evidence-based medicine. And also I have the understanding from everything that's happened throughout history when it comes to really changing things for the better, revolutionizing things, is that the science alone isn't enough. Opposition from vested interests needs to be overcome. So as long as I'm alive, as long as I have the microphone and the platform to be able to spread the message and make people aware of all these issues and problems, I will absolutely carry on 100% doing what I'm doing.
Fantastic. Thank you so much. It's been brilliant to speak to you today. And thank you. Bye-bye.